Ready, set, nurse. Are you preparing for nursing school? Do you want to know what questions are they going to be asking on the entrance exam? If so, this video is for you. Good morning. I am Nurse Eunice. I am one of your favorite nurse entrepreneurs, content creators, and nurse educators. So that's right. Once you earn your LPN or your nursing license, the sky is the limit. You can do a lot of things. You're not going to be stuck inside of a hospital or a nursing home. That's what I'm here. So let's get you first to pass your examinations. And then after that, we can teach you about being a nurse entrepreneur. So let's get started. If you need additional resources, check out our website. So, of course, we have our YouTube channels. We have one that is Florida Training, and then we also have one that's my personal YouTube channel. That's Eunice Mathis. Our website is fltraining.com. We are not a nursing school, but what we do instead is we supplement nursing schools. We teach those classes such as CNA, CPR. Once you have finished nursing school and you are not confident with your skills, or if you didn't pass your NCLEX examination, we do NCLEX prep, and we also do the hands-on clinical skills review. So there is no reason for you not to pass your exams and for you not to be a competent nurse. We are going to help you with that process. And then if you need free study guides, I know we have a lot of websites, but if you need free study guides, go to nurseeunice.com. Have all types of free resources. And then I also have some bundles that are only $5. So thank you for supporting a nurse-owned business. All right, so question number one. Which organ is responsible for filtering blood and producing urine? Would that be the kidneys, the liver, the pancreas, or the lungs? And because I know my students will be arriving in a few moments, we're just going to get to it. So you got 2 more seconds, 1 and 2, to put your answers in the chat. If you chose A, kidneys, you're absolutely correct. So the kidneys filter waste products from the blood. They also regulate fluid balance and produce urine to remove toxins from the body. Question 2, which of the following is not a function of the skeletal system? Is it A, protection of the internal organs, B, production of red blood cells, C, regulation of body temperature, or D, the storage of minerals? Which is not a function. All right, revealing the correct response in 3, 2, and 1. Go ahead and put your answers in the chat. And if you chose C, great job. So the skeletal system does not regulate the body temperature. Instead, the skeletal system provides the structure, supports movement, and produces red blood cells. However, it does not regulate body temperature. Number 3, the heart has how many chambers? Let's see if you remember your anatomy and physiology. Does the heart have 2, 3, 4, or 5 chambers? We'll give you a few seconds to answer this question. All right, revealing the answer in 3, 2, and if you chose C4, you are absolutely correct. So we have the right atrium, the right ventricle, the left atrium, and then the left ventricle. So the heart consists of 4 chambers. The chambers work together to circulate blood throughout the body. Question 4. The trachea is part of which system? Is it the cardiovascular, the respiratory, digestive, or nervous system? All right. When someone's having a tracheostomy, what body system is affected? Revealing the answer in 3, 2, and yes, it would be the respiratory system. So the answer is B. The trachea, or the windpipe, carries air from the nose and mouth down into the lungs, which makes it a very crucial part of the respiratory system. Number 5, which type of muscle is involuntary and found in the walls of hollow organs? Would it be A, skeletal muscle, B, cardiac muscle, C, smooth muscle, or D, voluntary muscle? And if I haven't told you, get paper and pen, write some notes. You're going to see these questions again in nursing school. And remember that in order for you to actually get accepted into nursing school, you often have to take a pretest, whether it's the HESI, they usually have some type of pre-entry examination. So let's help you prepare and start studying for that. All right, so the answer to question number 5 is smooth muscles. That's right, it is C. So, smooth muscle is found in the digestive tract, blood vessels, and other organs. Unlike skeletal muscles, it contracts involuntarily. Question 6, this is true or false? The liver is part of the endocrine system. True or false? Ooh, I see some correct responses coming in. Revealing the answer in 3, 2, and false. The liver is part of the digestive system, not the endocrine system. And so the liver produces bile for digestion and helps to detoxify the body. That is why if somebody has liver failure, they end up becoming toxic because they cannot excrete the ammonia. So the liver detoxifies the blood. Question 7, which part of the brain controls basic life functions like breathing and heart rate? Is it A, brainstem, B, cerebellum, C, cerebrum, or D, hypothalamus? And if you have a hard time pronouncing words, look, we've all been there. If you have time pronouncing words, you can use Google. You can use some type of app on your phone that whenever you type a word in, it will pronunciate the word for you. And that's going to help you become a much more competent caregiver because it is hard to pronounce and to know what all of these words mean. All right, so if you said brainstem, great job, team. It is A. A is the answer. So the brainstem, which is the colored portion in the video on the image there, the brainstem regulates involuntary functions such as breathing, heart rate, and blood pressure. And so we have the midbrain, we have the pons, we have the medulla, the basilar artery, and also the vertebral arteries. All of those components together make up the brainstem. Question 8, the smallest functional unit of the kidney is called what? Is it A, nephron, B, alveolus, C, neuron, or D, hepatocyte? And while you're answering that question, I'm going to sip on me some coffee. All right, revealing the answer in 3, 2, and... Yes, nephron, it is A. The nephron is the kidney's filtration unit responsible for removing waste and maintaining fluid balance. Number 9, another true or false. Oxygenated blood is pumped from the right side of the heart to the body. Oxygenated blood is pumped from the right side of the body, right side of the heart to the body. Is that true or false? Revealing the answer in 5, 4, 3, 2. Great job, team. That is false. That's right. It is the left side of the heart that pumps oxygenated blood to the body, while the right side pumps deoxygenated blood to the lungs to get reoxygenated again. So on the next slide, we'll actually show you kind of like how the chambers of the heart. Of course, the heart doesn't look like the heart that we see on cartoons. The heart is more actually the strongest part of the heart. The ventricles are at the bottom. And so that is kind of like whenever you're trying to get the ketchup out of ketchup bottle and you kind of thrust it. So the ventricles, the very bottom of the heart, is what circulates the blood to the body. So the left ventricle, the very bottom, circulates the oxygenated blood to the body. And then the right ventricle at the very bottom, it is what circulates the blood to the lungs to get reoxygenated. So this image, take a picture of it. You can refer back to it. Or if you're really, really nice, you can email me and say, hey, Nurse Eunice, send me a copy of the slides. And I might consider. All right. All right, let's go to our next question, team. Question number 10. Which blood vessels carry blood back to the heart? Okay. So if it's going back, that means it's probably lacking oxygen. So that's going to be the hint. So, which blood vessels carry blood back to the heart? Would it be arteries, veins, capillaries, or arterioles? Remember, if it's going back, so it's going through the system and now it's coming back, it's deoxygenated. So, which of these would carry deoxygenated blood back to the heart? Yes, it is veins. It is B. So veins return deoxygenated blood back to the heart, while arteries carry the oxygen-rich blood away from the heart. And whenever you take anatomy and physiology, they will talk about the whole blood cycle. You'll understand how the heart and the lungs work together to not only oxygenate, but to also perfuse the entire body. So it's very fun. I love the cardiovascular system, and I hope you will too. Question 11, let's do some medical terminology. What does PRN stand for? Is it A, per rectum, B, per renal, C, after meals, or D, as needed? And you're going to see these medical terms a lot, so you have to know what they mean. Maybe not for your CNA examination, but definitely afterwards, because you're going to be reading charts and you're reading care plans, and you need to know that PRN stands for as needed. So it is D. PRN means as needed, often used in medication administration, or maybe the patient can get up at limb, or that is as it's kind of like something similar to PRN. And so if you haven't already done so, please like the video, share with your friends. Look, we are helping people around the world pass their examinations, and we can't do it without support from viewers like you. So we do thank you and we appreciate you. And if you haven't made it official, if you've been hanging around me and you've watched more than 3 videos, you need to go ahead and subscribe. Help a nurse out. We're almost at 1 million subscribers, and I want to reach that goal next month. So help a sister out. All right, question 12. The prefix hypo means what? Is it above, below, equal, or around? Hypo, above, below, equal, or around? Oh yeah, this one's an easy one because you've been watching my CNA videos. So you know that hypo, whenever something's po, such as when I was in college, I was so po, not poor. I had no money, so my funds were low. So whenever you see the prefix hypo, it is below normal. So it is B. Hypo means low or below normal, such as hypoglycemia. So we have our prefix, and then we have our medical term, and then our suffix. So hypo, low, glycemic, usually refers to the actual sugar level, and emia refers to the bloodstream. So hypoglycemia is low blood sugar levels. Meanwhile, hypothermia, what do you think that means? Go ahead and put it in the chat. Plus, there's an image right there, and I have it on the screen. So yes, hypothermia means that the body temperature is lower than normal. All right, question 13. What does the medical abbreviation NPO mean? Is it A, no physical output, B, normal post-op, C, night patient order, or D, nothing by mouth? What does NPO mean? And we're going all the way to 25 questions, team. All right, and I know, look at you all. You're so smart. I can't fool you. Yes, it is D. NPO means nothing by mouth. That means that this patient is probably either going for a procedure, they're going to be having surgery, or maybe they came in, they were really sick, they were vomiting. We don't want to put anything additional on their stomach so they can vomit that up too. So your physician, the diet order will say NPO, which means they cannot have any food nor any drink. Question 14. A patient with tachycardia has A, a slow heart rate, B, a normal heart rate, C, a fast heart rate, or D, low blood pressure. Tachycardia. All right, and pronounce that word with me. Go ahead and say it. Tachycardia. All right, so the answer to 14 is C. That's right, a fast heart rate. And so your patients won't know the term tachycardia. They may say they feel like their heart is racing. And so tachy means fast, and tachycardia refers to a heart rate over 100 beats per minute. Question 15, true or false? Dyspnea refers to difficulty breathing. True or false? All right, revealing the answer in three, two, and you're absolutely correct. It is true. So DYS means difficulty, and then the P is silent. Nia refers to breathing. So dyspnea refers to shortness of breath. 16. What is the primary purpose of using a gait belt? Is it A, to keep the patient's clothing clean, B, to prevent the patient from getting out of a wheelchair, C, to assist the patient with transfers and ambulation, or D, to measure the patient's waist size? What is the primary purpose of using a gait belt? Yes, you are correct. It is C, and she's not holding that gate belt properly. She was taking her CNA test. I would fail her. It is to assist the patient with transfers and ambulation. So gait belts provide support when helping a patient stand, walk, or transfer from one location to another. We do not use gait belts to fix someone, to tie them into a wheelchair. That will be considered a restraint. So after you get through ambulating this person or transferring them, you are supposed to remove the gait belt. And then don't forget that whenever you're applying a device such as a gait belt to a patient, you want to do a 2-finger check. You want to make sure that at least 2 fingers can fit between their skin and that belt to ensure that they have proper circulation. 17. What is an important step before taking a patient's blood pressure? Is it A, ensure that the patient has a full bladder, B, asking if the patient has had caffeine or smoked in the last 30 minutes, C, making sure the arm is above heart level, or D, using a stethoscope only if the patient is over 60? Which is an important step? Yes, it is B. It is B because caffeine and smoking can elevate blood pressure readings. So it's important to check before taking a measurement because maybe you can do some other things while you're in the room and then come back and take their blood pressure. If you're in the hospital, I know that time is of the essence, but maybe this particular day you're working in a clinic. And so, if that person has already smoked, if they've had caffeine, then not only will their blood pressure might be slightly elevated, but their heart rate could be elevated also. And that means that we would have an inaccurate reading. And you might as well recheck it anyway. So, if that patient can wait a few moments, that would be the best response. Number 18, which position is commonly used for patients experiencing shortness of breath or respiratory distress? Is it A, supine, B, Sims, C, Fowler's, or D, lithotomy? Let's say that twice. Lithotomy. All right, let's see. Yes, friends. Yes, team members. You have the correct response. It is C, Fowler's. Okay, and so there are 2 different Fowler's positions. There's semi and there's high. So semi is like when they're reclining. All right, so the food hasn't arrived yet. She can be resting. She's not flat, but she's not already upright. So semi Fowler's, think about 45 to 60 degrees. But if they are about to eat, or if they're having respiratory distress, put them in high Fowler, sit them up, allow those lungs to expand. And plus, it will also help prevent aspiration. So, high Fowler's position is typically when the head of the bed is elevated to 69 degrees. It promotes lung expansion and improves oxygen exchange, making it ideal for patients with breathing difficulties and ideal for patients at risk of aspiration. Have them sit up whenever you're feeding them. Question 19. What is the primary role of insulin in the body? Is it A, to raise the blood pressure, B, to increase, sorry for that typo, oxygen levels, C, to aid in digestion, or D, to lower blood sugar levels? What does insulin do in the body? We're getting to those hormones. When you think hormones, think of the endocrine system. All right, and so what is the primary role of insulin? Yes, it is D. It is to lower blood sugar levels. And when someone when someone is diagnosed with diabetes, it's either their body doesn't produce insulin or it doesn't produce enough. And that is when we will give them usually oral tablets initially. But if they need their insulin replaced to control their blood sugar, there are different types of insulin. And so this image shows, I think this one is novel and N. It shows the insulin syringe, and since this person's pancreas is not producing enough insulin, they're going to get their insulin subcutaneously. So insulin helps regulate blood sugar levels by allowing glucose to enter the cells for energy use. And remember, if the pancreas doesn't produce it, we have to give it to them subcutaneously. Question 20. Oh, you got to do some math. Do you have your pens, your pencils, and your paper available? So question 20. A physician prescribes 500 milligrams of a medication, but the tablets available are 250 milligrams each. How many tablets should the patient take? A, 1, B, 2, C, 3, or D, 4? All right, I'm going to give you about 10 seconds. I know you can do it. You can do it. I have faith in you. Revealing the answer in 5, 4, 3, 2, and yes, it's B. It is 2 tablets. So to achieve 500 milligrams, the patient must take 2 of the 250 milligram tablets. So here's our math. We have 250 times 2 equals 500 milligrams. Question 21. Which of the following is not considered an opioid medication? Is it A, morphine, B, hydrocodone, C, ibuprofen, or D, oxycodone? Which is not an opioid? And another way for you to think about this is, which of these is available over the counter? Because opioids are not available over the counter. So if you can just go to your pharmacy and pick it up and put it in your basket and walk out with it, that is not a controlled substance. So opioids are controlled medications. So the correct response, the one that is not an opioid, yes, you have it. It is C, ibuprofen. So ibuprofen is a non-opioid pain reliever, while morphine, hydrocodone, and oxycodone are opioids. And whenever a patient has an opioid overdose, what do we administer? What do we give to them? That's right, naloxone or Narcan. You're absolutely correct. 22, family. Oh, you have to do some more math. A patient is prescribed 0.5 grams of a medication, but the available dose is in milligrams. You have to do a conversion. How many milligrams should be given? 0.5 grams to milligrams. Would you give A, 5 milligrams, B, 50 milligrams, C, 500 milligrams, or D, 5,000 milligrams? I'm giving you 10 seconds. And I know that's not a lot of time, but you can always come back, watch the video again, pause it, slow it down if you need it slowed down. But for time's sake, I'm giving you 10 seconds. So we have a few more seconds left. We're going from 0.5 grams to milligrams. And if you multiply it by 1,000, you are correct. And so the answer would be C. So whenever you're going from grams to milligrams, you multiply by 1,000. So 0.5 times 1,000 equals C, 500 milligrams. Fortunately, your pharmacy isn't going to do you like this. They will already have it converted for you in most of your facilities, because our job is to make your life simple and to prevent medical errors. However, you still have to know your conversions and how to do medical math as a nurse. Number 23, true or false? The abbreviation IM refers to intravenous medication administration. True or false? Revealing the answer in 3, 2, and false. That is false. IV is intravenous. IM stands for intramuscular administration. And so intramuscular means that it's going into the muscle. Usually your needle is going to be about 1 inch to 1.5 inches. For an average size person, may have to be a bit longer, not this long, may have to be a bit longer if the person is morbidly obese. But IM stands for intramuscular, not intravenous. Number 24, in which patient is a patient placed for vaginal or perineal procedures? So related to the perineal area, the vaginal area, the doctor has to look, what position are you going to help that patient get into? Is it supine, lithotomy, Trendelenburg, or lateral? All right, for the ladies who've ever had a pap smear, and the doctor puts you in those stirrups, there's a name for that position. And that position is called B, lithotomy. So the lithotomy position involves lying on the back with the legs supported in stirrups, commonly used during gynecological exams and childbirth. Number 25, which of the following vital signs is abnormal for an adult? Is it a temperature of 98.6 degrees Fahrenheit or 37 degrees Celsius? Is it a heart rate or a pulse of 110 beats per minute? Is it a respiratory rate of 16 breaths per minute or a blood pressure of 118 over 78 millimeters of mercury? That's what the mmHg stands for. Which of these is abnormal for an adult? And notice we say for an adult, because if you're going to be working with the kids, pediatrics, you have to learn a whole different set of vital signs and unfortunately a whole different medication range. So I prefer to work with adults. If kids are your thing, don't forget you have to go back and do a little more studying, which is wonderful because that way you can be specialized. And usually if you specialize, you make a little more money. So, all right, our answer for 25 is B, the pulse or the heart rate of 110 beats per minute is abnormal for an adult. So a normal adult heart rate or pulse ranges from 600 to 100 beats per minute. So a pulse of 110 is considered tachycardia and may indicate stress, dehydration, anxiety, or illness. And guess what, team? We did it. Great job. I am so proud of you. Ready, set, nurse. We're going to nursing school. We're going to do this together because I know you can do it. If I did it, so can you. And so for my CNAs who are watching this video, remember, caring CNAs make caring nurses. So it's kind of good, the trajectory, the route that you're doing, because you're learning those bedside skills. You're learning how to communicate. You're learning how to work as a team. And so now you're also going to learn how to become a better nurse. All right. So a nurse who cares, remember, a robot cannot replace your caring hand and your wonderful personality. And I will see you all in the next video. Remember, we do have our nursing and NCLEX skills lab right here in Jacksonville, Florida. I did have somebody who tried to trick me. They had not completed nursing school. If you travel here and you've not completed nursing school, I'm going to figure it out and I'm going to send you home and you've wasted your money. So no Florence Nightingale happening over here, Operation Nightingale at Florida Training Academy. You need to know your skills. I supplement. Okay. So you need to know something. If I'm teaching you CNA level work and you're coming in for a nursing skills lab, I'm going to send you home because you are not prepared. So if you finish nursing school, if you have not passed your NCLEX, come and see me. I'm going to make sure that you understand your skills, that you do an entire online NCLEX prep course through Remar Nurse or Remar Review. We're going to make sure you are prepared, not just to pass that test, but to be a competent and a safe caregiver who puts patient care first and who treats the patient holistically. And so thank you all for watching. And don't forget, if you haven't subscribed, help a nurse out. Bye, everybody. I'll see you in the next video.